Thank you for participating in this webinar on appropriate documentation utilizing the Provation EndoWriter system with particular reference to the GIQuIC program. This is Dr. Brett Bernstein, Medical Director of Eastside Endoscopy and Director of Endoscopy at Beth Israel Medical Center. As all of you know, GIQuIC has been utilized at Eastside Endoscopy now for approximately 6 months. This program has been transparent to the members as it runs in the background and extracts data from the colonoscopy reports that are generated using the Provation MD writer. The program extracts 82 data points from each procedure, and there are 10 quality measures that are uploaded to the system. Over the last 6 months, after our preliminary analysis of the data, we have found that there are certain documentation errors that are being made in the system, despite the physicians in general all doing the appropriate work. I wanted to spend the next 10 minutes briefly reviewing a sample examination and the appropriate way of documenting the procedure so that all of our members, when the data is extracted, can have reports which accurately reflect the work that they are doing. On the left, the first field that generally needs to be filled in is the pre-anesthesia assessment. The recommended method for documentation here is to choose shortcut, ASA, and anticoagulants only. Upon depressing that, what you will see is a choice of antiplatelet agents and anticoagulants that are generally used. The physician should choose which one is being taken by the patient, followed by done. The next menu will prompt the physician to choose the number of days that the specific agent was discontinued prior to the procedure being performed. In this case, we'll choose 7. Following that, you will be prompted to choose the ASA classification of the patient. Please remember to confer with the anesthesiologist to confirm that the ASA classification that's been placed in the EHR matches with what is being placed in the MD record. The next field will be the difficulty of the procedure, which in general would be without difficulty. As you can see, the Provation system automatically takes you to the next field and to the most commonly chosen menu item. In this case, patient tolerance, and the patient tolerated well. Prep quality is one of the areas in which we have seen poor compliance with this in terms of documentation for GIQuIC. Prep quality is extracted by GIQuIC as being adequate, in which case that meets the measurement requirement. Adequate also maps in the middle panel to a choice of good or excellent. Physicians who choose fair or below will have that data mapped to the prep being calculated as inadequate. The benchmark for GIQuIC is 90% of patients having an adequate preparation. So again, the recommendations would be simply choose adequate or inadequate, or good or excellent, which translates to adequate, and the final method of documenting would be to choose adequate to identify polyps greater than or equal to 6 millimeters, which also would correlate with an adequate. In the indication field, the choices would be to simply choose from the available choices at the top of the menu. The easiest method to be in compliance with the indicators would be to choose from the QI indications box, scrolling over and choosing one of the choices here, which are as comprehensive as choosing from the a la carte menu. In this case, we'll choose screening for neoplasia, average risk, followed by done. In our center, the anesthesiologists are performing monitored anesthesia care with propofol. That is the appropriate choice. Under findings, I will review the removal of polyp or polyps. In this case, we'll say polyp, single shortcut. One would first choose the anatomic area the polyp was removed, followed by the size of the polyp, followed by its morphology, and finally the method by which it was removed. In this case, single polypectomy with a jumbo forceps, and the completeness of the resection also. One can then qualify the removal being for histology, followed by done. Under complications, the most common would be choosing from the top three. In general, no immediate complications. The impression will be filled in automatically from the choices that were made in the above menu items. Under recommendations, if polyp or polyps were removed, the correct documentation would be to choose repeat colonoscopy, followed by surveillance based on path, followed by after studies are complete. The physician can, if desired, choose an interval at which the repeat colonoscopy would be performed. However, this may change depending upon the reconciliation that needs to be performed upon receipt of the actual pathology results. Patient instructions here are populated from the recommendations menu. In this case, coding was already performed. Now, upon going to the print menu, you will initially see this box appear, and if you read the red, checked items are required for documentation. Although this is not intuitive, you should note that anything checked in red here needs to be filled in with specific reference to the blue items. So, anatomic structures and landmarks photographed. Even if you have documented by dragging the appropriate photograph to the diagram of the colon and indicated what picture was taken, you must fill this field out, as unfortunately GIQuIC does not map to the photograph and what the physician indicated. So when you see this box, please check off what photograph you took. In this case, we'll say ileocecal valve, followed by done. You will then see, next to anatomic structures, what you indicated was photographed. The diet is the next recommendation that needs to be filled out. In this case, we'll choose previous diet indefinitely. Under medication resumption, since this patient was on an antiplatelet agent and a polypectomy was performed, one would choose aspirin NSAID avoidance after polypectomy, and the time to restart the medication should be indicated. The final field, although checked off, is already pre-populated for us in the Provation system, so nothing needs to be chosen from that particular menu item. I thank you for listening. Please feel free to contact me at the center if you have any questions.